South Africa, suicide is the third leading cause of death for young people between the ages of 15 and 24. It's as the country marks Teen Suicide Prevention Week, but how far have we really come in our understanding of the issues that actually lead to suicide? Let's bring in counseling psychologist Thabang Mashigo, no stranger to the platform, who joins us now via our video link. And Thabang, it's great to have you once again. Thanks very much always for making time to chat to us. Let me just throw that question directly to you. I mean, as we mark this week every year, one hopes that we're making some kind of progress. Your take on how close we've come to actually understanding, especially the conditions, the context, the issues that lead to someone even attempting suicide.
Thank you very much, Ayanda. And once again, it's an honor to be back to Newzroom Afrika. Of course, it's not an honor to be talking about such a prominent topic. Suicide has been taken for granted in this country, and I would even say globally as well. I say this because we haven't applied or deployed active mechanisms to deal with the underlying causes of suicide and the act in itself. We haven't observed behavior actively in our personal spaces or with people that already have committed suicide. I mean, you mentioned a very critical stat there. 2 years ago, it was 1 in 14, and now it's 1 in 18. Who are committing suicide. And we know that with teenagers, the underlying issues are a lot of bullying and discrimination and a lot of problems within the family where they are not attended to. So I think this begs the question to then say, what are we doing as a society to explore neurobiological disorders which drive suicide? By neurobiology, we're looking at thoughts and behaviors. We're looking at mood disorders, which essentially lead to depression in that regard.
Yeah. It's interesting you mentioned that, because I was going to ask the question about, you know, a lot of the time there's conversations around suicide that take place in conjunction with conversations around mental health. I just wanted to gauge from you whether those two things are intricately linked, or are we just finding that in a lot of cases both conversations happen to be relevant?
Absolutely. I would say there is a dialectical relationship between the two. But of course, we're not saying that the main causes of suicide are mental health issues.
Right.
But what mental health does is it presents issues that are underlying. So remember, there's a difference between psychology and psychiatry. So with psychology, psych meaning soul, ology meaning knowledge, so knowledge of the soul. So unfortunately, we've now made it about knowledge of the mind. And when it comes to psychiatric, it deals with more the mental. Now, immediately when we say psychiatric, you're thinking, somebody is now going cuckoos, or they're crazy, or they're insane. All it's saying is that there is an imbalance with your brain activity and with your neurons because of the amount of stress that your body is experiencing. So your body is communicating something to your brain. And so when we look into those dynamics, we are now incorrectly diagnosing people because of the psychology aspect. But the psychiatry aspect, for me, has to be something that we need to focus on more, not only as psychologists, counselors, and medical practitioners, but as a society, because people are trying to intellectualize emotional issues. And this is where the problem is. We are not a society that deals with emotions. We learn to cope with them. And once we cope, we find ourselves in situations where they spiral out of control. For example, in my trainings around emotional intelligence, I teach anger management. And anger is just temporary madness. You're literally losing your mind in the moment of anger. So I think it's not just about mental health, but sometimes people feel trapped, number one. Sometimes it could be family issues that are not being addressed. Maybe because in this context, speaking about teenagers, they could be feeling trapped at home, or maybe they are exposed to an abusive environment. So there is no enabling environment for them to address certain issues. Having mood shifts, either you're happy, you're sad. Most could say this could be bipolar. A lot of people are walking around with undiagnosed bipolar and schizophrenia. changing of personalities. Sometimes a suicide could be linked to not talking about revenge, guilt, or shame. We also mentioned, increasing use of drugs and alcohol. So all our behaviors are underlying, yes. I'll leave it at that for now.
Yeah, I find the term knowledge of the soul to be quite profound, and you've mentioned it in passing there. I wonder if you could unpack that for us a bit more, Thabang, in a context where, dare I say, there isn't even a unanimous sentiment around whether humans have souls. But perhaps that's a theological discussion for another time. But this notion of the knowledge of the soul, what do you mean by that?
So it's very unfortunate that religion has sort of contaminated our understanding of what the soul is. The soul is not really it's not based on any theological definition or even inferred from something that we deem religious. The soul is where you and your higher power dwell, or where you find reserves of who you truly are. The soul is a form of communication. It communicates your desires. It communicates the things that you don't really like. And so oftentimes what we see is, I'll use an example of LGBT. You find that a child from an early age knows that they are attracted. Let's say it's a female who is attracted to other females, and that's something that comes from deep within, which is what the soul is communicating to them. And then moving forward, they experience external conflict coming from their secondary socialization. So that external conflict could be from family to say, no, you're not supposed to like blue, you're supposed to like pink. No, you're a girl, and this is how girls behave. They go to church and they're told that being gay or being lesbian is demonic. They go to school and there's no proper support structures. So the soul is where you dwell. It's who you authentically are. If you are in an identity crisis, or if you don't really know who you are, it goes back to having a conversation with yourself internally. So we call it a locus of control. How you respond to conflict in society, how you respond to people really comes from your inner being. And this is what I define as the soul.
Profound indeed. And I imagine that's a good place to start as we try to find our way out of this malaise, this kind of suicide crisis as it's being described in the country. Thabang, thanks very much indeed, as always. Lovely chatting to you.